Welcome to the ethical tool of moral case deliberation. This tool was developed by our ETHCOM team in Laurea, University of Applied Sciences in Finland. This is the facilitator's version on the tool for reflecting ethical challenges. We start by going through a short background and rationale for the ETHCOM project, as well as the use of the moral case deliberation tool. With increasing complexity of the healthcare settings, nurses and midwives, as well as nursing and midwife students and teachers, are confronted with an increasing risk to moral distress, severe moral stress, and its negative outcomes, such as burnout and even possibly leaving the nursing and midwifery profession. In the hectic clinical practices, the students will face new ethical dilemmas and might need new tools to address these ethical and moral situations. This tool will implement the moral case deliberation model to deliberate the ethical issues which Nurse Anne has encountered during her practical placement clinical work. This presentation is for facilitators, enabling to deliberate the ethical challenges in a moral case from bottom up and supporting their colleagues in ethical reflection without making ethical decisions. Moral case deliberation, MCD, is sometimes also called ethics case reflection, and it concerns a group dialogue among healthcare professionals on a moral question about a concrete, difficult situation from their practice. The MCD approach is used as an umbrella term for bottom-up moral group deliberations with a specific focus on moral issues in healthcare. Opposite to traditional top-down approaches, such as clinical ethics consultations and ethics committees. MCD is a group deliberation, like ethics rounds, reflections or discussions focusing on group's morale. All these are examples of ethics support with a bottom-up approach in which the ethicist facilitates the conversation without having an advisory role. Implementation of the moral case deliberation. The MCD is defined as an approach with 4 specific characteristics. 1. Perspective sharing via dialogue. 2. Training of moral awareness. 3. Moral emotional deliberation. And 4. Moral support and joint learning. The original moral case deliberation is a meta-model. It's a model describing all the stages and all the activities taking place during each MCD session. The 7 stages are 1. Introduction, 2. Case selection, 3. Method selection, 4. Factual exploration, 5. Analysis, 6. Conclusion, and lastly, rounding off. We will dive into these stages in the next slides. First, you introduce the characteristics of the MCD session to the students. So this facilitator-led dialogue takes usually about 45 to 90 minutes of time. It is advised that the facilitator schedules a time frame for the class depending on how much time you have to use. More details can be found on the toolkit template provided in the materials. The focus is on the reflection process of the healthcare professionals or students, more than on a decision or solution finding for a clinical problem. Expertise and moral wisdom is expected to be present among the participants themselves. No previous knowledge is required. Participants should have equal space for having a say, and the reflection should stay connected to the facts of the situation. Various conversation methods and styles can be used to structure the process. Stage 2 is the case selection. We have chosen the case of Nurse Anne from Susanna Huttunen's 2023 master thesis, which was done from the ETHCOM project. More cases can be found from the ETHCOM library, or the students can share their own experiences from practical placements in different care settings. Nurse Anne works in an intensive care unit. Her days are full of carrying out medical protocols, patient desires, and nursing responsibilities. She usually takes her time to explore the patient's viewpoint before completing the doctor's instructions. Nurse Anne was ordered to complete a daily manual therapy for the patient. The patient was in his terminal phase of life in the intensive care unit and refused to receive the manual therapy. Despite the refusal of the patient, the doctor ordered Nurse Anne to complete the manual therapy to ensure the mobility of the joints and to prevent pain. Due to the patient's will, Nurse Anne did not want to complete the doctor's order. She rehabilitated the patient for a couple of minutes so that she could document on the patient's records that the patient had been rehabilitated. She argued her actions for herself by reasoning that the patient rarely had time to realize what had happened to him during those couple of minutes of physical exercise. Later, Nurse Anne was thinking, by working this way, I fulfilled both the patient's will and the doctor's order. Stage 3. Method selection. Case participants. The number of participants and students can be low as 2 or as high as 20, depending on the size and dynamics of the class. The case participants are encouraged in exploring, finding and formulating different viewpoints to the moral questions and clarifying relevant facts and perspectives. By reflecting their own and other participants' viewpoints, they deliberate the possible consensus and ways of acting. The reflection should stay connected with the facts of the patient's, nurses, and doctor's situation, and not focused on clinical practice or ethical decision making. For the participants, it is important to stress understanding of other person's views, even if they don't accept them. It is good to remember that encountering a moral case needs time. The stage 3 continues. First, you might explore and find and formulate different viewpoints to the moral questions and clarify relevant facts and perspectives first by yourself. Second, reflect your own and partner's viewpoints. Third step, deliberate the possible consensus and ways of acting altogether. And the reflection should stay connected with the facts of the patient's, nurse's and doctor's situation, and it is good to remind the students to try to understand the other person's views even you don't accept them. The facilitator's role in the situation is not to provide advice regarding what should be done in the particular case. The role is to encourage the participants in exploring, finding and formulating answers to the moral questions, to clarify relevant moral facts and perspectives, to reflect one's own and each other's viewpoints, and to deliberate about possible consensus and ways of acting. Stage 4. Factual exploration of the case. The facilitator might continue by addressing the students by saying that we can start by discussing all together what is good care in this situation. Stage 5. Case analysis. In this tool, You as a facilitator can assist the participants by implementing the bioethical principles in the case. Remember that the aim is to deliberate the ethical challenge from multiple viewpoints. From ETHCOM Library, you can find a short presentation focusing on bioethical principles according to Bootcamps and Childress 2019. The bioethical principles are principle of respect for autonomy, principle of non-maleficence, principle of beneficence, and principle of justice. In the fifth stage, the students can discuss with their partners to identify the 4 bioethical principles in the case Anne. Before the deliberation ends in the stage 6, as the conclusions of the case, you will, as the facilitator, encourage the participants to reflect the actions from the viewpoints of the patient, nurse, and doctor. Conclusions of the case can be done as a joint discussion among the class. The facilitator can lead the discussion that how did the bioethical principles realized in the case Anne from the viewpoints of patient, nurse, and doctor. Stage 7. During the rounding off, you bring the case back to the evidence on ethical competence. According to Van Baarle et al. 2017 and Desnaux-Trimp et al. 2020, moral competence entails the ability to be aware of one's own personal moral values and the values of others, the ability to recognize the moral dimensions of the situations, the ability to judge adequately a moral dilemma and to communicate this judgment, the willingness and ability to act in accordance with this judgment in a moral responsible manner, and the willingness and ability to be accountable to oneself and to others. You can round off the session by questioning: was the atmosphere safe for the dialogue? Did the dialogue increase the awareness and enhance trust so that all partners were heard? Did the MCD model manage to support the participants to reach respective dialogue with people in sensitive situations? Can the MCD model be implemented in various situations? Here you can find more references on the MCD model as well as biomedical ethics.